Good morning, dear colleagues. Thank you very much for inviting me to participate in the second Dubai Accessible Tourism International Summit and to present after 2 years our experience on COVID and also link it up to the topic of the meeting and the summit. I will present the outline, a short update on the global issues related to COVID-19, the impact, a focus on disabilities and future perspectives. I would like to also brief you about WHO's role and mandate, WHO's governance, impact of COVID-19 and WHO, and how do we think we should be ending the current pandemic and keeping in mind also the lessons for the next pandemic. As of January 5, really, we are closing on 300 million cases globally of COVID-19, with around 5.5 million deaths. Each one of those cases, each one of those deaths are a person, a tragedy for some families or more. And recently, over the past 1 week, we are facing daily around 1.5 million cases that are being reported at the global level. This is a lot. However, we have also, over the past 2 years, made it with a lot of progress. 14 vaccines have been approved by WHO emergency use listing, and 8 are under process. And of course, there is a lot of tests that have been approved and are being used and so on. And we can tell that around 8,700 million doses of vaccines have been given so far. Of course, there is a lot of vaccine inequity, with 80% of those doses in high-income countries or middle-income countries. And the least developed countries have not yet covered all globally, less than 10%. One of the problems we have been facing, the variants that are being detected and showing, of course, a higher and stronger transmission. The latest ones, Delta and Omicron. Omicron has been reported in 100 countries and, of course, raising a lot of questions on immunity, cases with reinfection or evasiveness from vaccine, and the usefulness or the need for boosters, as well as, the severity and so on. We have to keep in mind also that, for example, Omicron has been reported in early December, first week of December approximately. We don't have yet a lot of time and the studies that are at macro level to really give conclusions. So we are learning as we are going along. There has been also a lot on impact on hospitalization, especially the first year of the pandemic when the health systems of many countries were overwhelmed. Recently, the impact and the studies are showing that probably for the vaccinated, the hospitalization rate is less, and definitely with less ICU admissions. I want to cover also the issues related to vaccine supply and the gap towards what we have put as 20% and 40% coverage goals by end of December 2021. There were many countries that have not received enough vaccines, but even those who have received vaccines have faced difficulties in delivering the vaccines. And I want to make sure that we look all at this point related to some of the countries where we have humanitarian crisis, where we have weak systems or shortage of health professionals and also facilities in order to provide the vaccines, and to face also or to respond to the queries by people who may not be really convinced of taking the vaccines. Why are we getting a lot of those variants? As we know, the more the virus circulates, the more the virus will evolve and will become variant. And hence, we are not going to be able to stop development of variants if we don't halt the transmission of the virus. And the best strategy for this is, of course, the vaccination. And keeping in mind also that with the vaccination, maintaining public health measures whenever there is high transmission. What we know currently about Omicron is that it is highly transmissible. We don't have more than just 1 month of hindsight, but we are looking at it as in many countries it is doubling in 1 day, 1.5 days sometimes. There are also cases of reinfection, which means that there is evasiveness from the vaccination, or even that the previous infection did not give lasting immunity. There are also some tests which may not be picking it up, so a very specificity in terms of how do we detect it and the PCR. At the same time, the management is still very effective against Omicron. We are, of course, still studying both Delta and Omicron and making sure that we disseminate all the information that is available about that. We have to keep in mind that for Delta and for Omicron, we have preventive measures that effectively reduce the risk of COVID-19. And we will not stop by, not repeating them. Physical distance, use of mask, ventilating and avoiding closed facilities or staying long time in a closed facility, avoid poorly ventilated crowded spaces, wash hands frequently, and cough and sneeze in the elbow, and get vaccinated. So it's a whole set of measures that need to be implemented. There is always, and here because we're talking about tourism, the need to make sure that international travel maintain a risk-based approach whenever there is SARS-CoV transmission or one of the variants that is rising. And we stress the fact that we need to look at how do we put travel bans. We're not for travel bans. They will not prevent international spread, and they will place a heavy burden on lives and livelihoods. We need to make sure that we are using an evidence-informed and risk-based approach on international travel restrictions if there is a line that is needed. And this always keeping in mind the IHR 2005 regulations, international health regulations. Travel for essential purpose should continue to be prioritized. We may say avoid travel because of the transmissibility or because of the vulnerability of a person. However, we may say that travel bans may not really work that much. And travel risk mitigation that could be implemented can include, for example, a multi-layered risk mitigation approach, delay or reduce exportation if there is a new variant, making sure that we screen at entry and exit passengers, or quarantining travelers. But all of this should be looking at the risk and the data and the evidence of a local source, and making sure that we respect the traveler's dignity, human rights, and fundamental freedoms. And travelers should remain vigilant for any signs of COVID-19, follow recommendations, and adhere to protective measures, using the mask and physical distancing as during travel and at point of entry. Of course, persons who have not been fully vaccinated or do not have proof of a previous infection are at increased risk of developing severe disease. Hence, 60 years old people and maybe those with chronic conditions should avoid. This summit focuses on disabilities, and what I can say is that it is important to make sure that all policies, including COVID-19 mitigation measures, response measures, and treatment, take into consideration the different categories of disabilities, and also make sure that they cover all the needs of the disabled, as we have issued the disability considerations during COVID-19 outbreak guidance. We know that persons with disability are 3 times more likely to be denied health care. They are 4 times more likely to be treated badly in a healthcare system, and 50% more likely to suffer catastrophic health expenditures. Persons with disabilities are disproportionately affected by COVID-19. This is directly due to the increased risk of infection and because of the barriers in accessing healthcare, but also indirectly due to restrictions to reduce the spread of virus, like the support in disruptions in the support services. We have also issued in the last World Health Assembly a resolution, EB 148R6, which calls for the highest attainable standards of health for persons with disabilities. It is not related necessarily only to COVID, but this is a wide strategy which aims to make the health sector more inclusive by tackling the significant barriers that persons with disabilities face when they try to access health services, whether they are physical, informational, attitudinal, and that could lead to discrimination and more vulnerability. And of course, during public health emergencies, it is important that the health sector is responsive to the needs of the disabled. WHO is governed by the World Health Assembly mainly, and this is the decision-making body that is attended by 194 member states, and they meet in May. The main function of the World Health Assembly is to determine the policies of the organization, to supervise the financial policies of the organization, and to review and approve the proposed program budget. It has also an executive board that prepare all the materials and all the documentation, the resolutions to the WHA. The ministers of all the countries that are member states sit in the WHA and decide on those policies, recommendations, and strategies. What was the impact of COVID-19 on WHO? WHO was definitely put in the spotlight, and its responsibilities highlighted, of course. But before COVID, as we know, we had several programs, including the work on the implementation of the international health regulations to strengthen preparedness planning, influenza pandemic response plans, national health security plans, risk assessments, and to put in place a network of epidemiologists and different forms and sources for surveillance of outbreak-prone diseases. However, as we reported even like few months before COVID, there was limited funding and limited support for pandemic preparedness overall. This is, of course, highlighted in the many evaluations and independent reviews that were conducted on the COVID-19, on the pandemic preparedness and response, and on WHO, and which currently highlighted the importance, again, of the international health regulations as a governance tool for the prevention, preparedness, detection, and response to public health emergencies. However, have called also for additional measures, such as the development of a pandemic treaty, which is now being discussed, and which the upcoming executive board will be looking into and proposing to the next World Health Assembly in May 2022 a resolution in this respect. Of course, there are negotiations going on, and WHO continues to lead and to manage the health response, coordinating with experts and professionals from all over the world, developing guidance, supporting research, and issuing updated technical guidance and clinical management tools as much as required, but also supporting the response and the vaccination measures in low-income countries. I want to comment also on the efficient response, and the efficient response in UAE is a good example. Most importantly, the component is a leadership that is committed, a leadership that is responsive, and that is having a vision about ensuring the safety and the health of all the population. Trust and community engagement are essential for the response to work. The dialogue and transparency in sharing information and in maintaining the public informed, but also engaged and supporting the different policies and the measures that the government entities are taking. Building enough evidence-based policies, and also using science, using a lot of the scientific background in order to deter infodemics or the wrong communication. Establishing coordination measures across all sectors, not only for health, because all were concerned and are still concerned. Ensuring enough communication and collaboration, whether at country level, within country, between sectors, but also across regions and across countries. Adopting a systems approach, looking at the whole of society, whole of government, and making sure that the strategies and the policies are multi-sectoral because of the impact on all sectors of COVID-19. Directing resources and prioritizing to where needed, making sure that there is forward planning, such as ensuring that there is enough vaccine, making sure that there is enough tests, working at the health workforce distribution, and also strengthening all the facilities into, making sure that there is isolation facilities or enough hospital beds or intensive care beds. Ensuring the continuity of care. Many people have, of course, chronic diseases, or even the COVID-19 will not stop a baby being born or a woman necessitating pregnancy follow-up to take that. And of course, all the people who suffer from chronic diseases to ensure that they receive the care that they are needed, that they are requiring, and that is essential. And making sure also that those who could not work, those who could not generate their own income, have social protection, or at least have their basic needs covered. The use of data, modeling, predictions, and projections, and testing hypotheses, of course, has been important in an efficient response. And of course, the digital transformation and using alternatives into the different services provision, and also making sure that, at least for health, services were not discontinued. The lessons for future pandemics. Hope that the treaty or the instrument that will be developed by the negotiating body will provide a good basis for solidarity and for common greater goal to prevent the future pandemics. What we have also learned is that wealth is health. Then we need to invest more in health systems, in universal health coverage, in preparedness, in health workforce, treating the health workforce like our army, making sure that we have stocks of medicines, vaccines, and capacities for response, and to be able to generate what we need in terms of these important products. Making sure that we rely on scientists and epidemiologists, and that we have enough of them. So encouraging future generations to be more involved in these fields. Looking at data systems, looking at, of course, also the use of artificial intelligence in terms of analysis, and in terms of using it for refining policies and practices. Making sure that we have communicators that are able to convince in the future, to nudge the population, and to make sure that they are in place and able to anticipate and prepare better for pandemics. The foundations, of course, for success in future pandemics: community engagement, the trust, the awareness, and the education, and most of all, the leadership commitment. We need to be kept aware of the weak links, whether it's the supply chain or the dependencies in terms of some of those supply chain, the monopolies, and also making sure that the migrants and refugees, the disabled, the people with determination, and also people on chronic conditions are well protected. A whole of society, cross countries and cross regional cooperation and collaboration, solidarity, one health and one planet. Camus has said, what's true of all the evils in the world is true of the plague as well. It helps men and women to rise above themselves. We hope that we will keep progressing and hopefully getting rid of COVID-19 as soon as we can. But we need to make sure that we also keep, for now, the protective measures, protecting ourselves, but also protecting others. Thank you.